Thanks very much. I always worry after a nice warm meal, sitting down in a somewhat comfortable chair, that if you guys nod off, I'm not going to point any fingers. I won't make fun of anybody. Might come tap you on the shoulder here and there. I've been known to fall asleep in a meeting or two myself, but I'll try to keep it entertaining enough. And I promise I won't use a lot of big words throughout the next 45 minutes of your life. Unfortunately, you won't be able to get those 45 minutes back, but I promise I won't waste all of them. 44, maybe most. So today, I want to talk about anthelmintic resistance, dewormer. Not something that you guys are, something that you're very used to using. Probably get very frustrated when it doesn't work, or you buy a product, it doesn't work. I get frustrated with technology. I don't use dewormer on a regular basis. I do talk about it and deal with some common complaints. Anthelmintic resistance is something that's kind of goes right along with antibiotic resistance as well. Kind of, I guess, more and more prevalent, more focus is being put on it, and therefore you have to listen to me speak about it on days like today. So throughout our talk, or throughout my talk, just going to touch a little bit on the sheep industry overall. You guys know a whole lot more about it than I do. You guys work in it day to day. Going to talk about GINs, or gastrointestinal nematodes. I promise I won't keep all the big words coming all the time, because I can't say it 5 times fast or say them all sometimes. Again, just talking about the dewormer resistance, and then what the industry is doing, and then and academia is doing to develop strategies on how you guys can work around anthelmintic resistance or dewormer resistance, and make your farm more efficient. And then we'll and answer any questions at the end. So I always like to start off with a couple statistics to get me warmed up. I'm a fairly nervous speaker, as you'll notice me stumble over words at the very beginning of a talk. I do settle down and go. Pretty consistent across. We have had a decrease in the ewe population over the last 15, 20 years. In terms of actual amount of lamb produced and consumed, it's been declining a little bit, but not drastically. In terms of where most of the ewes in the sheep industry is grown, or most of the lambs are grown, as the center of the university and center of Canada, Ontario is the main. About 30% of all lambs are produced here in Ontario. The Quebec coming in shortly behind at 25, and then the rest of Canada, if we like to talk about it. I do call this place home, so 16.5% there in Alberta. Again, because of this, Ontario is the hotbed of research, so obviously with the vet school there, of anthelmintic resistance. Unfortunately, we are losing a very big advocate for the small ruminant industry in Paula Menzies. She's decided to hang up her coat and retired, which is wonderful for her, not so great for the industry, but she's done a lot of wonderful things in terms of kind of progressing the industry and the research on the topic. So when it comes down to the bottom line, we all love to farm. I grew up on a farm. I don't currently farm. Would really like to get into it again, but when we look at the economics and what you guys get paid, supply management isn't something that the lamb market goes through. Market price, just like the beef, just like the swine industry, we go ups and downs. There's some years that are really nice. Sometimes you get a couple extra toys. Other years you wonder why you do it. Fairly steady with the market price of 110-pound lambs right now, if you guys are finishing them off. 2017, again, fairly close into here like this, and the predictions for 2018 are close as well. So again, overall long-term picture is promising. I'm not telling you to go, I'll double your flock sizes by any means, but at the same time, stability is nice to be able to go through and work on the farm that you have. So in 2012, when I was talking about Paula Menzies there, they did a survey of sheep farmers in Ontario. It was sent out to a whole lot more than 38, and I'm sure there's a few envelopes that might be sitting in a very deep pile in some of your guys' offices, or next to the toilet, or anywhere, possibly burned in the fireplace at this point in time. They had a pretty good turnout out of all the sheep producers in Ontario. 38 responded. pretty good. If you guys know the numbers or percentages, it's probably less than 10%, but hey, we'll take whatever data we can get and work with it. Kind of the average farm size out of the 38 farms that responded were just shy of 300 head, or less than 300. Main production cycle was meat, obviously. Milk is a very, very minimal part, but it is a growing revenue, or growing part of the sheep industry, and definitely a bigger part of the goat industry. When we talk about lambings per year, there's a few that do 2 cycles. Majority of the producers that responded were just 1 lambing per year. Relevant to the topic, ewes and lambs graze together on the same pasture, and average kind of grazing time was 4 to 6 months. Some were confined. That's why of these, a couple of larger ones were confined out of these producers. So the average age of weaning was down to 4 months. Average time on pasture of this study was right around 6 months. So this is a study that was done to identify resistance within Ontario sheep herds. Excuse me. And kind of build our base knowledge for the problem that was happening all over the world: Anthelmintic resistance, dewormer resistance. So in 2012, the Ontario Sheep Farmers Association, OVC, did this survey to get a general idea of the production numbers, what kind of systems we were working in, and then from there they went and did an on-farm study to identify if we had Anthelmintic resistance or not on farm. So these are the farms that they sampled and worked with. Probably fairly relatable for most of the people here in the audience on this. Out of this study, they had an open box that allowed them to, you guys could put all your complaints or concerns and challenges that you face on a day-to-day basis. And I guess going through the audience, high mortality rate of lambs. Anybody lose a few more lambs than they've wanted to in a year, maybe 2 years? Just a couple. Predation of lambs. Not obviously coyote population seems pretty strong. Without any hunting and that kind of stuff. Predation of lambs. Anybody lose lamb to a coyote, stray dogs, that kind of stuff? Any problems that way? It's definitely more one that happens out west in the prairies. There definitely, I hear a lot of that. And then one of the third and probably, I guess the most resounding part of the survey was endemic flock health problems and antibiotic or any Anthelmintic resistance or dewormer resistance were identified as one of the major concerns. You guys use Ivomec, hoping that it works. You still get a homuncosis outbreaks either in the post-lambing or in the lambs during July, August, September, depending on the year. Those are the 3 main things that were brought forward in this study. And so Paul took these. Obviously, mortality rate of lambs, there's a lot of different management things that come into play. Predation of lambs, OVC is a great school, but they don't have any ability to control that. Not a big issue, not as big as issue there. And then also endemic problems. So Paul is focused on Anthelmintic resistance and GINs, or gastrointestinal nematodes, for a long period of time, and this is kind of her bread and butter, and she's focused and developing strategies around how you guys can overcome Anthelmintic resistance on your farm. So I'm going to be preaching to the choir here, but for the economics of sheep production, obviously you can double your flock size if you wanted to, but in order to improve the bottom line, you have to be able to sell more lambs at the end of the year, middle of the year, whenever you sell. So we have to either increase reproductive parameters, we have to improve offspring survival, and we have to improve growth of lambs. More marketable pounds at the end of the day is going to bring a positive impact on your bottom line, or increase selling price of lambs, which is very, as you guys know, very tough to do. There's a lot of other outside forces. New Zealand's a powerhouse in terms of, and they flood a lot of markets with lamb that's very hard to compete against in terms of price-wise. So yes, we can do some marketing strategies, but when we look at improving the offspring survival and improving growth of lambs are two of the things that we can have an impact on right away. So, getting into the kind of the bread and butter, the stuff I actually know something about rather than talking about the industry that you guys know a whole lot more than I do. Gastrointestinal nematodes, wonderful little parasites. They're quite disgusting actually when you cut open do a post-mortem, cut open an abomasum and see all kinds of little what they call barber poles, which would be this little guy here, Homunculus contortus. This is what they do to the gut. This is Trichostrongylus that goes through, and that's a very, very magnified picture of what happens in the abomasum. These are glands that produce the acid to help digest. And then this is a nice little egg that you have. So when you send in a fecal sample to either the vet clinic or you do fecal samples yourself, this is what we, break down the manure, the feces, and then we get to count all those. It's a pretty fun Saturday afternoon, I won't lie. I've spent a lot of time looking at a microscope and counting those. You go bug-eyed after a while, it doesn't take long. With the gastrointestinal nematodes, or the GINs I'm going to refer to, because I'm going to stumble over the big words if I keep saying them. The main ones that we're looking at that have a negative impact on us, and the main ones that we try to focus on when we deal with deworming reside in the abomasum. And they are Telodrosagia, Homunculus contortus, and then a couple of species, Trichostrongylus. Yes, I made it through. I didn't stumble through Trichostrongylus. Those species are also found in the small intestine, and then you get some more nematodes that are in the small intestine, and then some in the large intestine. Anybody that falls asleep has to say this word here 4 times over. So when we talk about GINs, and we work with the life cycle of them, and again, I heavily rely on Paul Menzies for this presentation. This is a great little diagram of how they survive. So infective larvae, it all depends. Chicken or the egg that starts first. It actually is the adult that lays the eggs in the GI tract, and that then get passed out onto the pasture in the feces or in the barn in the feces. If they're on grass, they mature. They mature in the feces, and then they become the free living larval stage, which occurs on pasture. These little guys here do a really good job at crawling up blades of grass. If you and I were to look down, we'd never be able to see them. You take some grass and look in the microscope on a nice wet morning with a heavy dew, you'll see them climbing up. They obviously know how they survive. They want to get eaten by another ewe or another lamb. They then get eaten with the grass. They go from immature larvae and go into the stomach. They mature, they sexually reproduce, and they start the cycle all over. When it comes to the mature and the development into adults and how many eggs they lay, it is an incredible number of eggs that the adults lay on a regular or on a daily basis. And we'll talk a little bit more about that later. Sorry, that's a little bit of the lunch that's getting a second taste. So gastrointestinal nematodes, they're one of those things that we've dealt with for a long time. The management systems and the higher intensity grazing systems that we work with, overheard a couple conversations talking about global warming, warmer weather, warmer winters, inability to kill those eggs off through the winter leads to contamination of pastures. It's kind of a vicious cycle. They get picked up, and it builds and builds and builds. Thankfully, at minus 21, I don't think a whole lot is living out there this year, but we'll find out. When you get a very heavy infestation or the inability to get rid of these nematodes, they really do play a negative impact on the growth of your lambs. They decrease average daily gain. If a lamb is anemic, if they get a heavy load of homunculus, they lose blood. Anybody who's been dehydrated, you feel like lying on the couch, you don't feel like getting up and going for a run. Kind of similar, sluggish. They don't go up in the bunk, they don't eat, they don't digest as well. and overall they just don't grow as well. So you get the average daily gain that you want. You also have the economic impact of when we deal with homuncosis, and if you have a really heavy load, you can get type 1, which happens in lambs in the summer, type 2, which happens in ewes after, usually right around lambing time or right after lambing time, and you can get sudden death on pasture with the lambs, or really poor doing ewes that don't produce enough milk, which then their lambs don't do as well either. Again, it all cycles around and has a negative impact on the bottom line of your operation. So just a little bit about each, and these are all the ones that I talked about that are in the abomasum. Trichostrongylus axii, which is most commonly known as the stomach care worm, very small. If you do a few postmortems, you're bound to find a few in there. They just look almost like a little hair that's in the side of the stomach. The hard part about these is they're cold resistant. So at -21, you're not going to knock them out. The nice part is they don't kill your flock, they just make you less productive. So there is a positive and a negative there. They also don't have a lot of resistance to most of the anthelmintics that are used, so for ivermectin and that kind of stuff. Clinical diseases we usually see with a heavy infestation of them are late summer and early fall. If you see scours, bottle jaw, some decreased intake, some poor doers, some weight losses, nice lost pasture through the summer, and then you have a few ewes that are not gaining as much weight back as you anticipated. What happens is that they go in, and it was that picture that I showed, the really big, the blown up one. They go into the abomasum and they ruin the glands that produce acid, and so they don't digest the food as well. They can eat, but they don't pull the nutrients away from the food as well as they should. Telodysaugia is a brown stomach worm, or might be called ostratasia. Pretty common names for them as well. Again, very similar to Trichostrongula, is intermittent diarrhea, weight loss, decreased appetite, and then also a little bit of bottle jaw. Again, it also happens in late summer, early fall. As their life cycle continues, the contamination load builds up on pasture, and eventually by late summer, early fall, they can have some clinical signs there. Again, on post-mortem, if anybody likes the look of a Moroccan leather, then this is what their stomach will actually look like. They get swelled up, and I don't have a picture of it here. Thought I did. It was a very nice Moroccan leather cherry that you guys can picture up there. Again, it's supposed to be all kinds of ripples and folds in the abomasum, but it swells up and it almost looks like it's a stretched out leather pattern. And here is the homuncus, Homuncus contortus, or barber pole worm. If you have a good imagination, you can see a barber pole. And what this is that the white is the reproductive organ of the worm, and the red is actually the blood of a ewe that this came out of. So it's it's pretty self-explanatory, I think. What is Homuncus contortus, and why is it so bad? There's a couple reasons. What I talked about, number of eggs laid per each adult female, is one of the reasons why contamination can increase drastically on a pasture that's not rotated, or even if it is rotated properly. 10,000 eggs per day per female. Very, very prolific reproductive parasites. This can take a clean pasture and contaminate it. You go through a summer where you get a little bit of humidity, nice rain, takes about 3 weeks to develop. You can go from a pasture that's completely clean to a pasture that can kill pretty much any lamb that comes onto it within 6 to 10 weeks. It's bad once you get going on it. If you don't have the management, if you don't rotate properly and that kind of stuff. And I deal with a fair number of homuncosis, type 1 homuncosis, which is the death of lambs, on a regular basis. August, September is not a fun time. There's a lot of producers that calling, asking for advice, looking for. It's even better when your product is on back order, so you got to tell them that they have nothing to treat it with. Again, very, very I guess, economically devastating would be the way to do it when you have 100 lambs and all of a sudden 4 or 5 days later you have 50 lambs. It is one of those bugs that can decrease your population of saleable lambs in half very quickly if under the kind of perfect storm cycle. Clinical diseases. It's never the poor doers that die. It's always your biggest, healthiest lambs that are the ones that you go out in the morning and find dead. In terms of ewes and older animals, it doesn't often kill them, but it will cause anemia. They'll be very pale in the gums and the eyes. We'll talk a little bit about that later. They'll have the kind of textbook bottle jaw, and what that is that their blood volume is so low that there's not enough concentration of red blood cells in their blood vessels that the fluid just starts leaking out into their bodies. So they get a bottle jaw. Often they'll have udder swelling. Anywhere that fluid can hang is pretty much what happens. Again, these are very sick animals and often require some pretty intensive treatment. So, as I said, the clinical signs are all related to the continual loss of blood. For every one adult has 0.05 or will consume 0.05 milliliters of blood per day. So, on a usually, so 150 or say, I guess 75 kilogram ewe or animal has about 10% blood volume, 750 mils. I think the record of that when I did a postmortem or looking through postmortems was in an abomasum, there's close to 50,000 worms in one stomach. At 0.05 mils, you guys can do the math, but it's a lot of the blood per day coming out of that animal, and trying for those animals to try to keep living through this. They're anemic, they're very slow moving, and that is also why when you get a heavily infested pasture that they'll just kill lambs. They'll suck so much blood that they can't handle it, and they often die due to the symptoms. Not trying to be the bearer of bad news, but that's just what happens. So again, I talked about type 1 and type 2 homuncosis, and type 1 is what happens in the summer time, usually with lambs. Sudden death and mid to late summer often can happen earlier if you have a really warm, wet summer. Type 2 is what happens around lambing time with ewes. We get the hypobiotic stage. So the great thing about Homunculus contortus is that because they can't survive in the cold temperatures outside, they decided to be able to kind of adapt, and they're like, well, it's warmer inside the lamb, so I'm just going to stop growing and kind of go into hibernation mode in the layer of the intestine and stay there until it's time for the springtime to come around, and I'm going to kind of re-emerge and become active again. So they as the cold weather comes in, they stop reproducing eggs, they go into a hypobiotic stage, and then when the ewe goes through that stress of lambing, they pop back out. They realize that there's the immune system's down, and they figure that's a really good time because lambing's not difficult enough. They figure they might as well draw some blood and pull and become active again. So that's how they survive over winter, which is one of the reasons why we have to be strategic in the management tactics that we use to control them. So when I was talking about pale eyes and mucous membranes, this is not a healthy eye. Their eyelid here, or the corner of their eyelid, mucous membrane there, should be a nice bright pink color. This is what I talked about, a textbook bottle jaw. Maybe I'm suffering from anemia. I don't know. Since I went into industry, I have low blood volume. I've got a saggy chin as well. And then also some diarrhea and temporary or intermittent diarrhea. All three clinical signs they're tough to, I guess, to pinpoint exactly what the cause is. Homunculus does not cause scours. So if you have scour issues, it's mostly likely Trichostrongylus or Osteotagia. Bottle jaw can happen from all three. The severe anemia is typically just homuncosis that causes the issue. Again, you kind of got to use all your spidey senses and figure out what exactly you're dealing with. use the knowledge of fecal testing to see if your anthelmintics are working or not. But when you're having multiple animals on your herd that have all three of these, it's probably time to give your vet a call and get a strategy put in place to help you out. So, do I have a nematode problem? As I said, I've got bottle jaw, so maybe I do. However, overall herd and productivity measures are fairly easy to look for. You can look at weaning weeks, you can look at milk production of ewes, if they can grow two or three lambs and get going and let them gain and produce enough milk for them. Probably not a big issue there. Presence of clinical signs. And then obviously the best way to identify if you have a nematode or a gin problem is fecal testing, pre and post post treatment. And then also if you're wondering if you have a homunculus contortus issue, we like to use the FAMACHA scoring tool, and there'll be a little more on this, and that just allows you to identify how much their level of anemia based on the color of their mucous membranes. So this was developed in South Africa. Has anybody used FAMACHA in their management system on a regular basis to selectively treat? A couple hands up there. So again, this is what I talked about of a nice healthy color. When we looked at that other picture, it was pretty much as white as the fields out there. You want to see pink or almost red to some extent. When you get into, I'm partially colorblind, so when you get into the paler pink colors, the females in the crowd are much better at FAMACHA scoring than the males. Sorry, not going to stereotype, but if you know the difference between magenta and red, you're probably going to be better to decipher between 4 and 2 or 4 and 3. So they did make it easy. They've got a scale of 1, 2, 3, 4, 5. 1 and 2 are healthy animals. 3 and 4 are animals that you should treat. When you see a 5, you're just kind of wondering how they're actually still alive. They're pretty severely sick at that point, and the parasite load is probably high enough that you can treat them. But in terms of survival rate, it's down below the 50% mark at that point in time. So, anthelmintic resistance. Anybody have what is your definition of anthelmintic resistance? Or do you think you deal with anthelmintic resistance on your farm? Feel free to shout it out, not everybody at once though. Okay, anthelmintic resistance. This is a textbook definition. So they identify it as when a proper dosage of dewormer is used, it does not kill a sufficient number of parasites. So they calculate this based on taking a before treatment sample, and they collect a feces sample. They count all the eggs. Again, those fun Saturday afternoons. You treat the animal, wait 2 weeks, you take another fecal sample from the same animal. You just don't grab one from the yard, and you count the eggs, and you compare the total of eggs before and then after. And it allows you to identify if the dewormer that you used was actually able to kill the worms that are parasites that are present. So before 2010, Ivimec was a pretty common, is a pretty common dewormer that is used. Worked fairly well. The sheep industry here in Canada is fairly far behind in terms of how long it's been around a long time, but not nearly as intense as New Zealand or Australia. We heard all the horror stories that they have to treat because they're on pasture 11, 12 months a year, that they have to treat every 2 months. We're like, well, we really don't have problems with homunculus. This was in the early 2000s. We started seeing some lambs die early on in the early 2000s. Paula's research really picked up and funding really picked up then. 2012, we thought, it's probably time, actually it was 2010, probably time to really see what kind of levels of resistance that we have here on our flocks in Ontario. It was almost scary what they got back. So they went to these farms that they went to about 40 farms overall, and they did the pre and post testing with Ivimec. They also did it with albendazole, and they also did it with levamisole. And wanted to see the number of what worms are resistant and how common it was. Over 50%, hands up, do you think that farms had a resistance on their farm? Under 50%? Anybody that's asleep, hand up. Not picking you in the front row. Came back roughly about 93% farms had a resistance. Of those, of the farms that were sampled. The main culprit was Haemonchus contortus. Of course, you know, if you're gonna have resistance on one worm, let's make it the worst worm to have resistance to. So Haemonchus contortus was identified as the main culprit and had levels or resistance to Ivomec that were much higher than anticipated, but also was one of the reasons why we're seeing failure of treatment and some of the clinical symptoms and deaths that we were seeing earlier. And going forward, we realized this is probably the main one that, and we're like using the research from other countries, we realized that Haemonchus contortus has the ability to become resistant to new anthelmintics at a much faster rate than either Ostratagia or Teller dysphagia. Part of that is because it constantly sucks blood. It's exposed to higher levels than the other worms are, and just based on nature, everybody's ability to survive, you get resistance on a regular basis, or a much quicker basis. So, what causes it? It happens over time. The mechanism of the drug, just like antibiotic resistance, doesn't matter if you treat 4 billion worms, there's always going to be a number that survive. If we don't incorporate management strategies that help eliminate this, then the resistance gets passed on to more and more worms, and it goes from 3 or 4% of the population that's resistant to 30, 40, 50% of the population resistance, and then, you know, if we keep doing the same thing and we use all the anthelmintics that we use in the same way, we pass the resistance on faster. So, what increases the speed of resistance? Improper dosage. That dosage gun does need to be calibrated from time to time. Deworming at inappropriate times. And unfortunately, and I'm not pointing any fingers, the research in the academia used to tell us to deworm right at landing, deworm everybody right at lambing, send them out and we'll have clean pastures. In hindsight, that was probably not a great thing to do. We really needed to go back and look at how we use the anthelmintics and how, when to use them, how to use them. And that was one of the things that, unfortunately, the advice that was given 20 years ago didn't help our problem and probably exacerbated the problems that we have today. And then also, in terms of an industry's perspective, is that the fact that you guys only had a certain number of dewormers to use of different classes. So we have the ivermectin, or the macrocyclic lactones. We have albendazoles. We only have 2 main ones. Levamisole is pretty tough to get. And then we have now with Flucoop is a salicylanilide. That's one I'm not going to say again. So Cosanto. So really, for a number of years, you only had one dewormer to use, and we told you to use it improperly. That's not really a recipe for success. So this is what caused the resistance. We've identified that, and we've recognized the problem. That's the great thing about science, is it's always changing, and then we're always moving forward, and you have the ability to say that you're wrong and kind of move with it. We had the information that we had at the time. It's what we thought was best. So now that we know the resistance is there and it's very prevalent within Ontario, the Paul Menzies came up with and developed the 5-star worm plan. Anybody use the 5-star worm plan or has read the parasite handbook out of OVC? A couple hands in the crowd. Available on the OVC website. It's produced out in 2012. I believe they are redoing it. But it's a very, very good book it has some great management tools in there. There's also some seminars, talks like today. I'm not sure if I'll answer any problem or answer any questions or find any solutions, but at least I told you about the 5-star worm plan, so I didn't waste the complete 45 minutes. And then obviously the FOMACHA scoring tool. So we've borrowed tools from other countries that were developed in other countries that have suffered from resistance a whole lot longer than we have. So there's always the people in the crowd that say, what if I don't have resistance, or what if I do have resistance? Some people are still awake and thinking about, well, maybe I treated them last year and maybe I did have a few things that, or a few sheep that didn't look as good in the fall coming through, a few ewes in the fall coming in, flock overall is doing well. Maybe you don't have a lot of resistance on your farm. I try very hard to keep it that way, but don't be naive. Continue to educate yourself. Go find the OVC website, the 5-star worm plan, pasture management techniques, and then obviously coming into some genetic selection of the herd is also another thing to kind of help reduce resistance from creeping in on your farm. There always is the people that have confirmed resistance on their farm. Obviously, 90% of the people that did the study know they have resistance to Monkus. So what do you do now? It's very similar to this previous slide, but a few more extra steps. We want to collect information. We want to see what wormers that you're using, how well they're working, if they're working at all. We do that by fecal egg counts, pre and post testing. We want to go back and look. Maybe that Ivermectin gun that you bought 15 years ago, 15 mils is no longer 15 mils. After a number of years, those O-rings do wear out and they don't have the same suction. So maybe you're only dosing with 10 mils instead of 15 mils when you think you're 15. Again, looking for clinical signs within your herd. Do you have type 1? Have you lost a few lambs on pasture that you thought were big, healthy lambs? Was it only 1 or 2? Was it like a massive outbreak and you had a number of lambs die? And then, yeah, as I said, fecal egg counts, pre and post treatment. This is probably something that we should always be doing, and there is a cost to it. However, the cost of not knowing that resistance is there is much higher than the cost of doing some fecal egg counts every year. You can train yourself. There's some great online tools. Talk to your veterinarians. Most of them will do fecal egg counts. The OVC has a fairly affordable submission process as well. They do fecal egg counts. There's always studies going on through the OVC. The Sheep Farmers Associations are usually notified about them. They do put bulletins up when they're looking for volunteers for new drugs that are coming out, that kind of stuff. There's lots of ways to get reduced costs of these fecal egg counts. So when we look at confirmed resistance is on your farm, management strategies. The 5-star worm plan. Refugia. Has anybody heard of Refugia before? Couple hands. Either that or you're itching your head and I take it as a hand. Good timing nonetheless. And then also and clinical signs. We want to reduce the clinical signs based on maintaining Refugia, and Refugia is, it's tough to describe. I've got a really good video I'm just going to show you. Management strategies, and it's part of the 5-star worm plan as well. So the 5-star worm plan, again, we'll thank Paul Menzies for this. We want to manage the level of pasture contamination. We want to use anthelmintics properly. We want to monitor and treat animals selectively. We want to quarantine and treat new introductions or flock expansions. And we want to investigate treatment failure. So when we talk about manage pasture contamination, what we told you before is, treat everybody and then put them out on pasture. It's not actually what we want. Refugia is the population of worms that are in your system or on your farm, in the ewes that you have, in the lambs, that have not actually been exposed to any anthelmintics. When we treat animals, we only really treat about 25 to 30% of the entire amount of worms that are on the farm, and we don't want the ones that have already been treated to contaminate the pasture with resistant types. So if you treat an animal and then you put them on a fresh pasture, and the only bugs that are left in that animal are resistant to the dewormer you just used, that ewe goes out and spreads resistant worms all around the pasture. The idea is contaminate the pasture before treatment, it does, as with everything, it comes with a little more work. You put them out on pasture for 2-3 days, contaminate it with the whole number of worms. You bring them back in, only 2 or 3 days, you bring them back in, treat them. When they go back out, yes, they're going to spread resistant bugs or resistant worms. However, they're going to be diluted with the worms that have been out there that haven't been exposed. Again, We're trying to develop a symbiotic relationship where the contamination level never gets high enough to cause clinical signs or has a negative impact on your farm. At the same time, trying to make sure that we use management techniques to do this and not just rely heavily on anthelmintics. Evasive pasture rotation, we want to avoid peak exposure. So if you go out and rotate, it's roughly 14 days by the time homunculus gets laid as an egg and develops into an infectious adult. And those are the times that we want to avoid. So we want to rotate pastures every 5 to 7 days and try to, from 14 and 21 days after you take them off the pasture, you want to avoid that. So those larvae develop, they become adults, we want them to die on the pasture, is what kind of breaks down as. So we want to rotate every 5 to 7 days. And if you can do it, have more than 6 pastures to rotate them through. Again, avoiding that 14 to 21 day window. And then also not overgrazing. Overgrazing is probably one of the biggest things that leads to very heavy infestation. It's very tough in some weather and dry summers. The homunculus only has the ability to climb up about 2.5 inches onto a stem of grass. Any higher than that, they run out of energy and they get lazy. It's pretty much what happens. They're also heavy enough that the grass will bend over and they slide off. It's pretty much what happens. So keeping sure you have a 2.5 to 3 inches left on your pastures before you move them out is important. This is preaching to the choir, I'm sure, on this one. Proper anthelmintic use, again, using licensed products that have known are efficacious and following label directions in terms of dosing, calibrating the gun. An oral product has been shown to be more effective than an injectable. Weighing the animals. It's a novel concept sometimes, and I'm very bad at guessing weights. Some people are very good. We all think they're 120 pounds. I still think I'm 200 pounds. It's a pipe dream. We want to make sure the gun is calibrated to the weight. Going into to calibrate to your highest animal, it's okay to change the dosage if you have some bigger ewes and smaller ewes and lambs, and making sure that you're giving them the right dose for the weight that they are. And then proper technique. I know I've been guilty of it many times, not necessarily with ewes, but with cattle. You give an oral product, it goes in the mouth, but does it actually go down the throat? It's one of those ones where rushing through things doesn't actually get you to the solution any faster. Making sure that animal and that product goes all the way down that animal's mouth and down into the rumen is essential. If it ends up on the ground, it's not going to do anybody any favors. It's just a waste of money. So the next kind of part of the 5-star worm plan is monitoring fecal egg and egg counts and selectively treat. Does anybody selectively treat ewes after lambing, or do they do blanket treatments? There's a few hands out there for excellent. I like to see that. So this is kind of combining all the tools that we have and all the knowledge that we have. Doing fecal egg counts on random fecal egg counts, but also fecal egg counts before and after treatment are essential, but monitoring pasture contamination through fecal egg counts is also a good idea. As the summer goes along, just knowing what your levels and your burden levels are on those pastures can allow you to not put the ewes back or the flock back in that area and go to another pasture to let the contamination level die off. Maybe they can't even go back to that summer. It allows them to avoid those type 1 homuncosis outbreaks. Using the FAMACHA tool with lambing, combining that with the body conditioning score, and then obviously clinical signs. Using these two tools together is essential for selective treatment. So when it comes to lambing time, if you know you have homuncosis resistance to Ivomec, you come in with a new dewormer that you know is going to kill the homuncosis, but you have some animals that don't seem to be bothered by it, or not the dewormer, the homunculus or barber pole worm. You want to selectively treat, and the idea is we want to only only reduce the contamination in the ewes that are having a hard time dealing with homoncosis or the gin problem. A lot of animals are able to survive on it. Their body will kill those gins on their own. There's no need for dewormers or dewormer for homoncosis anyway. So what we do is we go through, we pick on the skinny ones, and we pick on the ones that are really pale, or pink, but not the bright red. So I didn't put it in there. The 3 and 4 on the scale of the Fibonacci card. If you can go online, you print them off. I just have a couple. I unfortunately didn't bring them today. Just a little laminated card, and you can actually just, as you kind of go through them, as they lamb, all depends on what your system has. You grab them, you tip them, you hold them, you look at their eye, kind of look at the card. You know there are 3, 4. She's a little skinnier. Okay, maybe she's got a high infestation, and you treat those animals that are in that right category. So the animals that we want to treat are the ones that are under-conditioned, and also the ones that have a Fibonacci score of 3 or 4. At 5, yes, the score of 5, and that's the pale white color. Probably should be treated, but they probably should be kept off pasture and give some supplemental care, a little more TLC. And again, treating the ones that have a bottle jaw and that kind of stuff, or looking at the ones that have bottle jaw and that kind of stuff are more important as well. So this is the idea of what happens what we used to do. This is deworming all ewes at lambing. So this is last summer. There's susceptible, and the R is resistant. The blue ones are the good ones. They're susceptible to the treatment. They contaminate the pasture, which is always good. There's a good mix of resistance and susceptible bugs out there. They build up over the summer. This is late fall. Hopefully your pastures don't look like this, but grass is drying up. We're about ready to bring them in. They are, fall, we're bringing them in. There's today. All these pastures, all these homoncus die off. They don't overwinter. Your ewes are in the barn, and they have worms that are susceptible to the Anthelmintic, and they also have worms that are resistant to the Anthelmintic because you've used it a couple times, or 3 or 4 times, whatever dewormer you're using. These are dying. Oh, we have lambing time, everybody's favorite time of the year. Lots of sleep at that point in time. And then we decide to treat absolutely everybody. At lambing, then, this is kind of getting ready to go in pasture. The only bugs that are left are those nasty little ones that are resistant. So they go back out on pasture. This is probably pretty self-explanatory, but the pasture is contaminated with resistant bugs, resistant worms. This is what we want to avoid. This causes a lot of big issues. We want pastures. This is going to take me a little bit. There was this extra slide there. I'm not sure what happened. We want pastures that look like this. We want to treat the animals that have heavy infestations of homoncus. We want to treat them. We want to leave the ones that don't to go out, contaminate the pasture with susceptible bugs, and then that dilutes out the resistant ones. So therefore, you have the ability to I guess, delay the resistance. We know resistance is going to happen eventually, and it does build up. If we work this way, it's going to build up a lot slower than treating everybody and going out. We only have, if we do it the old way with the homoncosis, with new families, we have 2, 3, 4 years max out of Anthelmintic before it becomes, before we have a population that's resistant, that's big enough to cause problems. Again, you can have 4 great years, but after that, there's big issues that come into play. So, Refugia is a population of parasites that, as I said, have not been exposed to Anthelmintic. When administrating, we really only hit about 20% or kill about a small percentage of the worms if you're doing it throughout the summer. Obviously, when it comes to homoncosis and you're doing it at lambing, you have the ability to affect the entire population. And unfortunately, there's no Anthelmintics out there that are 100% effective. So what we want is we want to have about 80% of the population that's never actually seen Anthelmintic. We do want parasites around, not necessarily Haemonchus contortus, but we don't have any ability to completely get rid of them. So we have to be able to manage the population in a way that works for the flock and also works for the worm. And by selectively treating, that's one of the ways you can do it. Quarantine new entrants. Again, all new entrants should be held off and drenched with 2 different dewormers. This allows, and then we do the treat and hold 5 days minimum, and we can place on a contaminated pasture. So we want to integrate them into the flock, and it's just the same as if you have disease status, you want their worm status to come in and match what your flock has. Investigating treatment failures, and sometimes that means calling your veterinarian and getting angry, which usually means to calling me and getting angry. You bought a product, you expect it to work, but we've got to work together on this. We have to follow the 5-star worm plan recommendations, and we also like to make sure that if you have a failure, we want to know why the failure. Was it improper dosing? Was it that the bug was already resistant to the product you used? We want to walk back through. We also want the ability, if you do the fecal egg count test before and after, we know if it worked. And then again, it is a cost to it, but there is information there that allows you to become a better producer down the road, and gives you information to deal with these outbreaks before, or prevent these outbreaks and not actually deal with the death of a lot of lambs. So for when it comes to dealing with in a herd that's resistant to anthelmintics, your only real choice is to selectively treat with a new class. This is going to be a little spiel for Elanco. We have a new product called Flucoop. We want to selectively treat them around lambing, at lambing time. Again, treating those skinny ones that have a Fibonacci score of 3 or 4. Lambs, if you prefer not to treat them at all, if you do experience a death and know that it is Haemonchosis in a type 1, you treat the flock so you don't lose any more. Again, those are often animals that are going to be marketed anyway, so they're not staying around on the farm. In terms of ewes that you're retaining, or females that you're retaining, still treat them on that so they do survive. Again, why we're doing this, we want to observe or avoid clinical symptoms, and then we're going to treat them, obviously mostly oral products are the best way to do it. So Flucoop is a new class of antibiotic, or Anthelmintic. As I said, it's a salicylate. It's 1 mil per 5 kgs of body weight, oral administration. It has a 49-day meat withdrawal. There's no established milk withdrawal time, so if you do have a milking herd, it is not to be used. It's a very narrow spectrum of action. It is it's only efficacious for Haemonchus contortus. It actually does not work against Teller dysaugia or Trichus strongylus. And this is a product specifically for herds that have Haemonchosis resistance to the current products that are on the market, Ivomec, etc. Efficacy studies were done here in Ontario, proving that it does work. Ewes were treated 4 to 5 days post-lambing on a selective treatment basis. Lambs were treated on a fecal egg count test. Fecal egg count reduction tests were done pre and post. It was very efficacious, 99.5% efficacious on all 6 herds that used it on and that was over 2 years. So in terms of using, it was shown that with selective treatment, resistance did not build up. Again, it also performed well in lambs, and I don't really like to do the push, but it is a tool Flucoop is a tool in your toolbox if you've experienced Haemonchosis outbreaks, and you've adapted those management techniques of the 5-star worm plan to bring in and selectively treat those animals to help reduce your burden of Haemonchosis on your pastures. Again, Anthelmintic, your resistance isn't going away. We have to learn how to deal with it. As researchers, and I'm not an expert in the industry, but the experts were wrong how we were telling them to do before. We have to adapt techniques. The 5-star worm plan and Polymenses is something that we know works. It helps the delay of resistance to develop. That's going to allow us to the products we currently have to last longer and allow us to develop new products. And then again, in terms of any situations you have, never be afraid to call and ask your veterinarian. They usually do spend a fair bit of time in their trucks driving around, and a few 5-10 minutes to chat is something that we're usually happy to do. Sometimes they're grumpy. Just tell them to call you back at that one. But so yeah, that's the. Any questions?
One here. Stand, please.
Does diatomaceous earth work? And have they changed the diatomaceous earth product?
Sorry, have they tried a diatomaceous? In terms of studies, I have not read any controlled studies that have showed efficacy of diatomaceous. I'm not saying those studies aren't out there. I have not done it. Anecdotally, I do hear positives and I also hear negatives. The mechanisms in terms of how it actions, there's some credibility there, but I have not done a deep dive into the diatomaceous earth. So.
You're saying that worms regenerate on pasture. Do they regenerate in total confinement? That's one part of my question. The other is, if sheep are totally confined, how long do worms live in sheep themselves?
Okay, the confinement question first. So worms don't regenerate on pasture. They regenerate inside the ewe. They then go in the field, get laid in the feces. Those larvae actually develop in the feces. They then use the grass as a way to get re-ingested into the lamb or the ewe to become mature again. And then they develop. So they go from an infective stage to a mature stage and sexually reproduce. This can happen in a feedlot setting or a confined setting if ewes are eating the bedding that are there. Doesn't happen at nearly the rate. The contamination levels, they're not nearly as, I guess the worms aren't as effective. I have dealt with homuncosis outbreaks in a completely confined environment. It is not common. Does not happen as easily. However, if you've got manure, bedding that's not cleaned out as enough, that kind of stuff, it can happen. But it is rare. There's a much, much lower risk in a confined environment. And I forgot your second question already.
How long do worms live inside a sheep?
For the hypobiotic stage, they can 6-10 months, depending. Usually they can survive quite a long time. Usually it depends somewhat on weather and then also immune status of that. So they've done some studies in terms of, a ewe goes out, she's not actually confirmed pregnant, and so there's no lambing stage. She's kept in confinement and she's had positive eggs, or her eggs have been there for a long period. It's not like at 10 months is the longest that I've heard, but it's not, I don't know, in terms of how long. So are you asking how long would you have to keep ewes on confinement for them to be completely void of all worms? Is that what you're asking?
Yes.
Yeah. I don't know if they're. Yeah. I'd say any more you're definitely in a reduction. I don't know how long it would take to completely void a ewe of all worms, especially if they go in the hypobiotic stage. They can last a very long time. Like assuming that you're not going to keep them inside for multiple years on end, and you're looking at like 6 to 12 months. But
if a person had them inside for 2-3 years, they should be clean.
They should be. I won't say they were going to be completely clean because I do not know. I would assume, and my educated guess.
Not a good word.
What's that?
Assume is not a good word.
My educated guess would be that they would have a lower number of worms to spread. So.
Why are they not researching on treating pasture fields instead of treating the sheep themselves?
Because it's a whole lot easier to treat the sheep themselves.
You're saying we can kill a lot more because there's so many eggs and larvae in the pasture fields if we treat it there. But we would kill the resistance thing. If you could do 100% clean.
But you'd have to, yes. So that's one thing.
But there is no research in that, is there?
not to, that's to the crop guys. You gotta come crop day for that. I don't know about that one.
Well, like, you guys are selling a product, so that's why you're not going to go that route.
We do sell a little. There's not, that's not where my area of expertise is. My area of knowledge is, I'm not gonna say expertise, the knowledge, that's plowing but like for homuncosis, we do decontaminate the pasture because nothing survives over the winter in terms of homuncosis, and we're still, it's the ability to go into the hypobiotic stage that causes the issues, right? It's the ability to survive in the lambs. So as long as you put them back on there, you can treat the pasture, but it's only a 3 week. So you're gonna pull your ewes off, wait, 14 days, treat the pasture to kill it, and then you have a 4 to 5 day window to treat the pasture. It's a whole lot easier. I don't know. For me, I think it's easier to treat the animal than the pasture, but.
We have another question here.
Okay.
My question is actually similar to treating the pasture. What about using a rotary mower? When I rotate my animals, I rotate horses on after the sheep, and then I rotary mow. And that's partly for annual weeds, but would a rotary mower affect the population on of the worms or in the pasture?
If you're getting rid of any layers, so it allows the heat and sun to dry out, you're gonna kill off the eggs that are the infective stage. So that you'll have eggs that are still there that can develop and mature to that kind of L3 stage that is infective. But you will, the ones that are, you will reduce the number out of rotary mowing, assuming that it's not the animals that are taking it down to that level. The rotary mowing, it exposes it to sunlight and dryness, and that's not good for they don't adapt well to dry heat on the pasture. So it is a management technique, and there is a section on the OVC, the 5-star worm plan, that does talk about mowing and different pasture management techniques. I just brushed on it. I highly recommend you guys all take a look at that. Paula's done a great job. I believe she is, one last kick at the can is updating it a little bit, but the tools that are there in that are very, very informative, much more so than my talk. It'll take you more than 45 minutes to read, but it is a great source of knowledge.
Do producers need a script to get the Flucoop?
So you don't need a script. It is through your vet product because it is a narrow spectrum. We're trying to make sure we don't want, and I know we're trying to sell it. We don't really want to sell a lot of it. We brought this in knowing that homuncosis homunculus resistance was in it. Elanco had this product in another country. We saw Paula brought it in or asked to bring it in for some research stuff. We saw the area where we have resistance at 90%, and we wanted to, so we don't, to be honest, like this is not a money maker. We lose it. It's a tool that is brought in to you guys to use. We don't want everybody to use Flucoop. We want selective treatment on farms that are have a resistance issue that have been identified through fecal egg count reductions and that kind of stuff.
Well, you just said you didn't want everybody to use it, so I hope I get to be on the cool kid list. But I guess my question then is, I appreciate your information on the susceptible and resistant Homunculus contortus that we do have, but I think from a realization standpoint, I can't guarantee that everybody that I work with or that you work with changes pastures every 5 or 6 days. So no matter what, those animals now have the Homunculus contortus as part of them. So even though that you've dewormed them, is there a certain time period that it's still logical to retreat them? Does that help?
So Flucoop is not a perfect product. If we had the people that developed it and identified it, it has a fairly long window of efficacious, so it's about 3 weeks that it works. In terms of building resistance, that is not ideal. You don't want a product that's that's a long half-life that slowly degrades in the system. We want the ability to, ideally it would have a three-day active window, and you didn't allow the bugs to be exposed to it over a long period of time. Sorry if I've lost anybody there on that one. I could just confuse myself. So for, I guess, I don't really have an answer to that question that's there on that. The idea is that it's not, Retreatment would be no sooner than 21 days because you have that window. Again, because of the slow half-life of the product, I recommend 35 days based on the Clisandros was introduced in the 70s in Australia and New Zealand. They've done a lot of work over there. That's kind of the recommended treatment window. If you have that big of an issue and you're getting reinfection at a high level that's causing symptoms already, there's probably relying on Anthelmintic is not the best way to go forward. You really have to look at management strategies on your farm, either, doing a rotational graze with another farmer that has a different species of animals that are not affected by homuncosis, finding a solution because you're burning matchsticks really quickly at that point in time, and if you're going to run out of Anthelmintics that work. So you really got to kind of come back and refocus on the management stuff. I'm going to plug the OVC 5-star worm plan one more time and have a read through that and adapt a few of them. Perfect. Thank you very much.